welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and follow us to stay up to date. Today, you have all of the possibilities and all of the tools for proper hygiene treatment, and the cost of those tools are pretty low. You can buy an electric toothbrush for $20, $30, which is very inexpensive, and it enhances the quality of your toothbrushing in an insane amount. It's recommended by almost every dentist. So you have all of the toothpaste too. You have dental floss, you have all of the things that you need. You just need to do this and want to do this and see that you're doing it right. So the first step is preventing. The second step is going to the doctor, because there are still things that you can't 100% prevent. So you do need to go for checkups, for follow-ups, for dental routine treatments, like going to the dental hygienist to clean the teeth for proper, deeper cleaning, because there are still things that are not easy to clean in-house. So once every half of a year, for example, go to a doctor or a dental hygienist. She or he will look at your teeth, tell you if everything's fine or if you need to do something. And this way, with the proper treatments, preventable treatments, you won't have any tooth filling at all. This is the intraoral scanner. For the last 10 years or so, we have seen a huge leap in digital technologies in dentistry. So today we are using less and less materials like silicone that we used in the mouth. And we're more and more using digital technologies and 3D scanners and some kind of animations showing the patient what you'll have before we even make it, and giving the patient the option to decide and to choose between different types of treatments. Now, how does this affect the patient themselves? Well, let's take a patient that has an extreme gag reflex. It can be a huge problem when we try to take impressions because the patient can't withstand the silicone material. In these cases, the intraoral scanner is amazing. Sometimes with the intraoral scanner, you need to take less kinds of impressions. You can, instead of taking the whole jaw, you can just take a portion of the jaw. It makes the treatment much less annoying and much less inconvenient. Now, with the new technologies, of course, you have the ability to make the work so much faster. So today, there are patients that can finish the whole process in one day, take impressions, and then the next day you have the final work. There are cases when you need to wait. You need to wait for proper healing. You need to wait for the biological factors. The technology can't make the healing much faster. You still need to give it a couple of weeks, but yes, you can today make some aesthetical solutions, some minor solutions right away or in the same day or maybe in the next day, and you will see the results will be high quality. And that's something that you couldn't do before. Today, we're not sending a patient without a frontal tooth home. There's no way. With the digital new solutions that you have, the work of the dentist is much more precise. With this precision, we can start using different kinds of technologies that we're afraid of using before. Because before, if you had a big bridge for the full jaw, the worst was some concern in taking impressions. You weren't sure that you took the impressions that you needed and that the final work will fit. So in many cases, you choose to separate the bridge into 3 or 4 pieces, or you choose to make a cemented restoration, even though it's not the best possible way for this type of work. Today, we're using more and more screw-retained restorations because for proper screw-retained restoration, you need to have a high accuracy. This way, you can screw the restoration into the mouth and unscrew it when you need to check to fix or have any adjustments to the restoration themselves. When you place an implant, one single implant in a place that you don't see, that you don't need immediate aesthetic solution, then you can wait a little bit. It would probably be better to place the implant and wait this amount of time and wait till the implant will heal, and then you'll have good restoration. When you apply too much force on the implant that hasn't healed properly yet, the body can reject the implant. It's something that you don't want, and you always have that risk. First of all, you don't need to save all of the models like we used to. You have everything digital. All the information you took is like on the cloud. You can access it, and you can always see what was and what's now. It's one of the greatest things that has happened, because now if the patient has some type of restoration and the patient broke the restoration, he can call the clinic. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you and see you next time.